Registration for the GRAFT registry was incredibly simple and effective. Within about a 10-minute period of time, I was able to sign electronically my agreements and get signed copies sent back to me.
The GRAFT database is very easy to use, very easy to access, and helps us accumulate the data that we need to get good, solid evidence behind our fat grafting methods, as well as establish the safety of this procedure in all applications.
It takes about 10 minutes. Once you do it, your nurses can enter all the data before and after your procedures.
GRAFT is important because fat grafting has become the standard of care for our specialty and for our members.
In my personal practice, fat grafting has increased dramatically, anywhere from breast, for reconstruction, for touch-ups, for buttocks augmentation, for facial aging.
It may turn out that there are multiple ways of harvesting fat, purifying fat, and then grafting the fat. And I think the GRAFT registry will help us to get to some of those answers.
One other thing to consider is that obviously other specialties who may not be trained in this may want to be doing fat grafting. As plastic surgeons, if we can show that we monitor our results and we have a database going forward, I think we can be in a position to be much more authoritative on the fact that we are the ones that should be doing this and are leading the efforts and giving patients better outcomes.
We know how many patients are being treated by fat injection, what their short-term complication rates are, where the fat's being used. So it's really important information for our specialty.
Because plastic surgeons are innovators, and that's our core competency, we've looked toward fat grafting as a novel technique that we now need to scientifically measure and follow. So GRAFT allows us to combine and pool the experience of everybody within the society so that we have robust enough data that we can show the efficacy and safety of fat grafting.
If you are doing fat grafting in your practice, it's so easy to be a contributor, to make a difference to our specialty by putting your data into the GRAFT registry.